Mobile County. So today for Mobile County, we're reporting on 12,490 cases. 55 were added yesterday, 59 on Wednesday, and 37 on Tuesday. So we are still seeing a very low number of COVID-19 confirmed and probable cases reported to us. 270 people have died with COVID illness, and the cumulative number of people hospitalized with COVID is 1,831. That was an increase of 10 from yesterday. And on average, we're still seeing around 105 people in the hospital each day with COVID-19 diagnosis. Yesterday, there were 104. That was down slightly from the day before. Some of you may have noticed, in fact, a couple of people have called me that there were some issues this morning with the Alabama Department of Public Health public COVID dashboard. There seemed to be, they may be going through some updates and making a few changes, and it wasn't refreshing properly for me, and I know a couple of you had trouble too. So again, just to say, yesterday for Mobile County, 55 COVID positive were added, and our total number of died with COVID is 270. Also on Friday, we usually give the number of complaints that we've received this week. So for permitted establishments, so those are restaurants, bars, daycares, pools, tattoo parlors, those sorts of things, we responded to 16 complaints. Oh no, sorry. Among those, there were 3. For all other businesses, there were 16 complaints last week. So a total of around 20 businesses that we spoke with this week in response to your email or phone call to us that they were not complying with the Safer at Home order. So again, just to remind you that we are still under the August 27th amended Safer at Home order that requires the wearing of facial coverings when you're out and about. Also provides, direction for businesses on limiting capacity, and then restrictions on other businesses are all found in that report, and that is effective through October 2nd. I wanted to share that. We don't talk about this always, but I thought I might mention it today. We are continuing to speak with our long-term care facilities every week, some of them 2 and 3 times a week when they need us most. But for now, we have COVID positive patients or staff in 11 nursing homes. So there are 26 long-term care facilities right now that are reporting no cases or no patients with symptoms. So that's really good news for the county, that our nursing homes, due to greater availability of testing, test results coming back in a more timely manner, some changes in the CDC guidance about how long you have to keep someone on quarantine or isolation. So those things are really helping our nursing homes stay ahead of the COVID game when it comes to outbreaks in those facilities. So I have a couple of questions here that that I want to address. But before I do that, I just wanted to say a big thank you to Lifeline Counseling Services. They stopped by today to bring joy and encouragement and thanks and lots of gratitude to the health department, to several of us here, and we just greatly appreciate their partnership and want them to know how much their thoughtfulness means to us. It was a great pick-me-up. All right, so some questions. Let's see, one comes from a viewer. It made me smile when I saw this, because this must be someone with a science or data or maybe statistical background, and he's asking for some additional stats in our weekly report, things like talking about when we say the average length of hospital stay, that's the mean average. Most people don't understand the difference from median and mean, so or mode, so we generally don't use those terms of central tendency. Rather, we just say the average length, and that's the average mean. Also asking us if we could break up things, age groups, into smaller categories. We often get this request, and when we can break it out further, we do. I'll try to, if not in our weekly report, maybe give you some of those stats verbally next week. In general, we follow suit with whatever the Alabama Department of Public Health is doing or what the Centers for Disease Control is doing. That's generally the way we make decisions about how to break out things like age group. And then zip code, there was a question about zip code, looking at 7 and 14-day trends in zip code so that we could see, where we have current hotspots or, current trending up or current trends down in certain zip codes. We have extended an offer of employment to a GIS analyst, and hopefully we'll be able to do some more things. We've been lucky to have been partnering with the city of Mobile, who've been loaning some GIS support to us, but hopefully we'll have that capacity our own. Before COVID, I was the only person who was running statistics and reports on COVID data, and before that, communicable disease data. So now that we have some funding to support COVID, we're able to hire another master's level epidemiologist, a PhD level epidemiologist, a GIS analyst, and another data analyst or two. So when it was just me doing it, you kind of got what you got, and we didn't have much depth for anything more. So we'll continue to take your suggestions and look at things as they come in. All right, a question on Facebook about what's happening with senior facilities. A Facebook viewer who was mentioning that she's not seen her mother or giving her a hug since November, that she must be in a senior facility. So yes, there still are strong recommendations not to allow visitors in healthcare settings and long-term care facilities. However, there is some leeway on a case-by-case basis, so you can speak with the facility administrator and see if you can negotiate some terms of maybe visiting. We have heard some creative things, Facebook and tablets, people maybe talking, through seeing their loved ones through windows, maybe, outdoors if you're maintaining 6-foot distance, maybe at either end of a picnic table. So people are really getting creative in trying to let folks who are in congregate settings spend a little bit more face time with their families, because of course that's very important for all of us. All right, here is a question from one of the news stations asking, what risks are teachers taking by going into classrooms with 30 plus students? The answer to that, it really depends. If the school has been following the guidance of public health and of the superintendent of, or the commissioner of schools, and if you're able to maintain that 6-foot distance, if you're wearing masks, if you're disinfecting surfaces, then you can keep your risks very low. However, anytime we're in close proximity of people who don't live in our household, we're putting ourselves at additional risk. This is true for teachers, it's true for the students, it's true for restaurants that have people that, so anytime we are congregating, particularly if it's within 6 feet, with people who are not in our household, we're potentially exposing ourselves to others who may be infected and not know it, and may be spreading virus and not realize even that they have the virus. So, but this is not just applicable to school. It is the same for beaches and for restaurants and movie theaters and skating rinks and churches, particularly any place that we are in closed doors and it's difficult to maintain that 6 foot of physical distancing, then we're always going to be at slight increased risk in those settings. So teachers, students, administrators, please stay safe out there. And we're starting to see some data come in that our schools are reporting cases as they have been instructed, and hopefully we'll be able to start giving you more visibility on what those numbers look like sometime next week. All right, here's another question for the media about COVID vaccine under development, that CDC is urging states to begin preparing for distribution as soon as November 1st. And a caveat to that, yes, CDC is encouraging preparation, but in November, the vaccine that will first become available will likely have some cold chain issues, and that means that it will need to be transported under extremely cold temperatures, probably requiring liquid nitrogen, which means that most likely it will be hospitals who get those first doses of COVID vaccine, and the vaccine will also be prioritized, where those people who are at greatest risk of complications or deaths of COVID will be the first ones who are eligible to receive COVID vaccine. And then the question goes on to say that the state health department, so the Alabama Department of Public Health, is involved in preparations, and this reporter was asking what Mobile County Health Department has been doing to prepare for vaccine distribution. So at the Mobile County Health Department, our emergency preparedness program has been working for many years with our area healthcare coalition to plan, prepare, and practice mass vaccination. And in fact, we had planned an exercise where we were going to offer hepatitis A vaccination just at the time that COVID came to Mobile County. And so we are looking forward to scheduling some mass vaccine events, drive-through events, when we get enough vaccine to do that. Now, I do want to make sure everyone understands that COVID vaccine for just regular people, healthy people, is not likely to be available anytime soon. It will be probably long into 2021 before there is enough vaccine that anybody who wants the vaccine can get it. But I do want to remind you that it's not too early to get your seasonal influenza shot. So at the bottom left hand of the screen, there is some text, and you can see on that text that there is a website called vaccinefinder.org, and you can go there and type in what type of vaccine you want to get. So if you need a tetanus vaccine or a flu vaccine and what age group you are, so just click, influenza flu vaccine and type in your zip code, and it will show you all the locations around you that already have flu vaccine. So please don't wait to get your flu vaccine this year. We want everyone to get it as early as they can, because when seasonal influenza returns to us, and it starts late September, October, it's going to be mixing with COVID, and that's going to make diagnosis more difficult. The message will be the same. If you have fever and cough or a cold, any of those flu-like symptoms, we want you to be at home isolating yourself and not being around other people. But if you can, go ahead and get a flu shot. Go to vaccinefinder.org and start preparing now for the seasonal influenza season. And again, we're just keeping a really close eye on it, because it looks like we're going to be mixing flu and COVID infections. And so that's going to be tricky to tease out. So again, flu shot early. And there are lots of other prevention messages that I want to pass along. So this week is Labor Day. This is the first 3-day holiday since July the 4th. And I would like for everyone to remember what our July looked like. July was the peak number of cases for Mobile County, because we had so much action around the 4th of July holiday. Back then, lots of people, were not wearing masks, were not physical distancing, were not taking things seriously. They went about and played and sported and worked without really tight adherence to the safer at home order. And we had a record number of cases. At least once a week, we would break our record for the daily number of cases reported. And July, by far, has been the month with the highest number of COVID cases. So please, we have worked very hard, and you have done well to help bring those COVID numbers down to their lowest since before July. And please, this weekend, as you're out and about, enjoying the Labor Day holiday and celebrating Labor Day with your friends and family, please wear your mask, stay 6 feet away from people who are not in your immediate household, disinfect surfaces, take yourself out of the game if you're sick, stay at home if you're sick, because we don't want to see another, result of not adhering to the safer at home order, not doing the things that we should be doing to protect our community this weekend, turn into a new spike in cases in September. So please help us keep an eye on what we're supposed to be doing, what we have been doing to bring the numbers down, and keep it up. Please help us keep it up. Okay, some other things to remind you on Labor Day weekend. Again, we don't have treatment. We don't have a vaccine for COVID, so maintain your distance. Stay at home when you're sick. Cover your cough or sneeze. Disinfect frequently touched objects and surfaces. Wear a face covering when you're out in public. Don't touch your eyes and your mouth, and frequently wash your hands. People will be grilling, and there are risks that come with grilling. So every year, people are injured using backyard charcoals and gas grills. So please, only grill with adults. Make sure in open areas. Stay safe when you're grilling. Never add charcoal starter fluid when coals have already been ignited. Follow manufacturer grill instructions. Never grill inside your home. Always, have an adult or someone to supervise. Picnics. If you're planning to go on a picnic, only take the amounts of food that you will use. Most foods are safe for shorter periods when they're stored on ice or on frozen gel packs in a proper cooler. And creamy or custard foods and salads using store-bought mayonnaise are safe if kept cool in a cooler. But remember, when you're picnicking, it's sometimes hard to keep things cool, so just be aware of those things. You don't want to develop a gastrointestinal illness because you ate some spoiled foods on your lovely picnic. Sun protection, limit exposure to direct sunlight between 10 and 4. Those are the peak UV exposure times. Wear a broad spectrum sunscreen. Reapply often. For beach safety, if you're going to be at the beach or in the water, make sure that the shore includes swimming areas, swim in designated areas, and preferably if there's a lifeguard present in a designated area, and obey all the instructions. If there are riptide flags flying, stay out of the water. Keep a close eye on young children. This goes for also when you're around pools. Make sure if someone is not a skilled swimmer that they're wearing a flotation device. If you're boating, wear a flotation device. Drink plenty of fluids, and don't forget that it's also sort of bug season. So we do know that we have West Nile virus circulating in mosquitoes. So make sure that you use a repellent that contains at least 20% DEET for protection against mosquitoes, ticks, and other bugs. So I think that's all for our COVID and Labor Day updates today. I'll just, on behalf of the MCHD Employee Association, don't forget that the virtual fishing rodeo ends Tuesday. So get out there and take a picture of you with your catch and release fish with a ruler. Good luck.